Okay, hello again, Emergency Medical Responder, Chapter 12, Behavioral Emergencies. A lot of our folks that we encounter out in the field have behavioral types of problems, but it's not always necessarily behavioral. Sometimes it's linked to medical as well. In this particular chapter, we're going to cover behavioral emergencies and see if we can't dispel some of the myths that we may have out there with regards to behavior. All right, so emergency situations have emotional and psychological effects on rescuers, patients, family members, and friends, and even bystanders. First responders need to give psychological support as well as necessary emergency medical care. 5 factors contribute to behavioral changes in us human beings: medical conditions, physical trauma, psychiatric illness, mind-altering illness, and situational stress. All right, so once again, the assessment, the 5 components of the patient assessment sequence: scene size up, primary survey, history taking, secondary assessment, and reassessment. Say that with me. Scene size up, primary assessment, history taking, secondary assessment, reassessment. And the more I drill that into your head, the better off you're going to be as you move through along, not only with this program, but if you go to EMT, because this is the same thing that we teach in EMT and paramedic. This is the universal assessment for emergency medicine. All right, so patient assessment and behavioral emergencies. When you're assessing a patient who appears to be experiencing a behavioral emergency, follow the steps of the patient assessment sequence. Complete your scene size up, being especially careful to ensure that the scene is safe for both you and for the patient. If the patient is oriented and responsive, complete the primary assessment by observing the patient's responsiveness, airway, breathing, and measuring their pulse. History should follow the sample format. Do not neglect to ask about medical problems. It is important not to overlook this part of the examination. Okay, the secondary assessment should rule out any obvious injuries and focus on the signs of medical illness. First thing you want to do is you want to take a set of vital signs. Tell the patient what you are doing at each step of the way. Reassess the patient every 15 minutes for a stable patient and every 5 minutes for an unstable patient. In cases where you cannot complete the assessment, document the assessment findings and the reason for not completing all the steps. All right, so continue on. Medical conditions, other signs and symptoms that you can see in behavioral crisis is head injuries, high fevers, infections, and excessively low body temperatures. Any of these can create a condition of a behavioral crisis. Also, physical trauma, head injuries, injuries that result in shock and inadequate blood supply to the brain. Then you have psychiatric illnesses, such as depression, panic, and psychotic behavior. Any of these can cause a behavioral type of crisis or emergency. And then if the patient's using a mind-altering substances, such as alcohol and a wide range or variety of chemicals and other drugs that they can consume. And then also situational stresses. These are stresses from a variety of emotional type of traumas, death of a loved one, or a serious injury to a loved one. There are 2 examples of this. All right, so what is a situational crisis? So we had a behavioral crisis, and now we're talking about a situational crisis. This is a state of situational crisis, is a state of emotional upset or turmoil. This crisis is caused by sudden and disruptive events such as a physical illness, a traumatic injury, or the death of a loved one. You will often encounter this type of crisis as a first responder. Most situational crises are sudden and unexpected, such as a motor vehicle crash. It cannot be handled by the person's usual coping mechanisms, so it becomes a true crisis for them. It usually lasts only a short time and can cause socially unacceptable, self-destructive, or dangerous types of behavior. Phases of a situational crisis. There are 4 emotional phases to each situational crisis. 1, people may not experience every phase during a crisis, but will certainly experience one or more. Understanding what these phases are and why they occur will help you to better treat people who are experiencing an emotional type of crisis. High anxiety or emotional shock. High anxiety is characterized by obvious signs and symptoms such as a flushed red face, rapid breathing, rapid speech, increased activity, loud or a screaming voice, and also general agitation. Emotional shock is often the result of a sudden illness, accident, or sudden death of a loved one and is characterized by cool, clammy skin, a rapid, weak pulse, vomiting and nausea, and also general activity and weaknesses. All right, so denial. This is the refusal to accept the fact that an event has occurred. Your response should be somewhere around in the follows, and every situation is different, but you need to allow them to express their denial. Don't argue with the patient, okay? Just listen to them. Be empathetic. Be an active listener. Try to understand the emotional and psychological trauma that the patient is experiencing. Could have anger, okay? Anger is a normal human response to basically overload or frustration. This is going to happen, so allow this to happen. Just try to contain it and make sure that the scene is safe for you and for the patient. Anger may also follow denial or may occur instead of denial, so therefore it could replace it. In a crisis, people may vent angry feelings at you or other authority figures. Don't take this personally, but acknowledge that it is a reaction to stress. Frustration and a sense of helplessness, they often can also build them up to anger as well. Always be professional and don't react to anger by becoming angry yourself. Remain calm and deliberate in your actions and prevent an escalation of violence. Remorse or grief. This is the next phase. This is acceptance of the situation. It may lead to the remorse or grief as that part of acceptance. People may feel guilty or apologetic about their behavior or actions during the incident about what has occurred, whether they took it out on you or took it out on somebody else. In this figure, it's just showing, comforting from an acceptance or getting into the situation that leads to grief. As you can see here, that this is a friend or a loved one, perhaps, that's helping to reassure and calm down the patient with the first responder in the background, as you can see here. All right, so crisis management. The overall role of the first responder is really to follow the steps of the patient assessment sequence. We need to do everything that we normally do. Get your scene size up, do your primary assessment, get the patient's medical history, perform your secondary assessment, and provide your ongoing assessment. Absolutely, you got to do all these things. After completing that primary assessment, you may need to obtain the medical history and perform an actual physical exam in case there is any medical injuries. Your most important assessment skill may be your ability to communicate with the patient. Communication is a key. Patients don't like to be not communicated to. You need to keep them informed on what's going on. That is very, very helpful, including the family as well. All right, so some of the communication techniques, talk with a person, introduce yourself, always introduce yourself. Remember, you cannot touch somebody without their consent. Ask the patient his or her name and use that name. Don't say honey, sweetie, bud, dude, or anything else. You need to use their name. They could be in a very volatile state or right on that edge. So if you set them off just by simply not talking to them in a professional manner, then that's going to be on you. Ask what you can do to help them. Be honest, warm, caring, empathetic, and position yourself at the same patient's eye level. As you can see here in this particular representation, this is your first responder here, and notice that he's got direct eye contact with this patient, and he's down at his level. But he's also in a stance that if he needs to escape, he needs to jump up and get back quickly, he can do so as well. I also want you to notice that he's wearing his gloves, his PPEs. Please do not forget that. That's part of your scene safety, scene size up, is to make sure that you have your personal protective equipment on. Notice over here, this first responder on this side, He's got a far enough distance away, okay, but he's not down on this patient's level. You also have to be very careful with your hand gestures. Look at this hand gesture here. This almost says, what, who, why am I here, kind of thing. So be very careful with those hand gestures. Make sure to get down to their level, calm, relaxed, listening type of position. As you can see, this is more of an active listening position than this is. Absolutely. All right, so establish eye contact, use calm, steady voice, and provide that honest reassurance. Don't let your negative personal feelings interfere with your attempt to provide assistance. No matter what you may think about the situation, you may be dealing with a child abuse type of situation in which this might be the perpetrator and they're having an emotional breakdown because of it, but don't be judgmental of them. Simple acts of kindness can provide comfort and reassurance. One of the things that we always did is we always made sure that we had a case of water on the truck. Water is very important. And just a simple act of offering somebody water is a big deal. It may not seem like a big deal to you, but it serves a couple of purposes. One, if they're awake and alert and able to swallow, you're helping to rehydrate them. And two, you gave them. That is an act of kindness. So that's very, very helpful. So think about that. All right, so restatement. Restatement is rephrasing a person's own words and thoughts and repeating them back to that person. It is usually not helpful to say, I know what you mean, or I know how you feel, because the first thing they'll say is, no, you do not. So be honest and give the patient hope, but don't give them false hope. Also, redirection. This sometimes a patient may be embarrassed about, being the center of attention, or maybe concerned about others involved in the situation. So redirection helps to focus on a patient's attention on the immediate situation or crisis. Redirect them away from, what's going on, and hopefully it'll refocus them on something that's a better place than where they're at. All right, so in continuing with redirection, using redirection alleviates the patient's expressed concerns for only a temporary basis. It really, really does. If the patient's in a public place, move them into a quieter area. There's no reason to have them out there in the middle. And then, like I mentioned earlier, empathy. This is the ability to empathize. It involves imagining yourself in another person's situation and sharing that individual's feelings or ideas. With that empathy, it's one of the most helpful concepts you can use when caring for patients in crisis. You use a very calm and caring approach, and your communication skills are well sharpened. You pay attention and be that active listener, and that's going to put you in those empathetic shoes. Communication skills, bottom line, is principles for dealing with behavioral problems. Identify yourself, always number one. Let the patient know that you're there to help. You're not there to judge anybody. You're not a cop. You're not going to do anything. You aren't going to arrest them. You're not going to take them away. You're just there to help out with what's going on. So inform the patient of what you're doing. Let them know every step of the way, especially before you touch them. Make sure that you get their consent to take their blood pressure, to take their pulse. That way they know that you're going to reach out and touch them. Some people are very, very, they might set them off to do that. So be careful in your approach. Most people are going to be very welcoming to this, because it's in itself, it means that you care and that you're providing some comfort to help, and also to see if there's a medical reason wrong that's causing their problem. And, if there is, they're going to be happy that, oh, I can fix this, kind of thing. All right, continue with this. Ask questions in a calm, reassuring voice. Allow the patient to tell you what happened. Be that active listener and don't be judgmental about it. Show that you're listening by using restatement and redirection. Restate what they say. And like we said earlier, don't say, I know what you mean, I know how you feel, those kind of things. That's bad verbiage. Instead, what you say, I can appreciate what you're telling me. Tell me more. Okay. Let's get to the root of the problem, on what you think is causing your bad day today. And acknowledge those feelings and assess the patient's mental status overall. Are they talking sensibly? Are they giving you good information? Are they giving you bad information? You're looking for the appearance, activity, speech, orientation of person, place, and time, their mood, their thought processes, and their memories. All right, crowd control. Sometimes this is an issue. You got to be able to deal with it. Performing simple crowd control may help to reduce the patient's anxiety when there's too many people around. It makes people really nervous. Any emergency personnel who are not needed right away should leave the room until the patient is calm. During your initial scene size up of the scene, determine whether there is a crowd that might become hostile. It is better to ask for help with an unruly crowd early than it is to wait until the situation is truly unsafe for you and the patient. So call for help early. If law enforcement's not already there, get them there to help you out. All right, so let's chat a little bit about domestic violence. Domestic violence is a common occurrence in today's society. It comes in different forms. It comes in like forms of elder abuse, child abuse, spouse and domestic partner abuse. First responders need to be able to recognize the signs and symptoms of abuse and to understand the 3 phases of the cycle of abuse. When responding to a domestic violence call, you need to maintain safety for all rescuers as well for the patient. Also, conduct an effective assessment and a treatment. You need to understand the requirements for reporting abuse in your state as well. Make sure you know what is a reportable incident and what is not, because you need, if you don't report something, you might get into a situation. Signs and symptoms include physical injuries, the emotional state of the victim, and the personal indicators, personality indicators of the abuser. Physical injuries could be broken bones, could be cuts, could be bruises in different stages of healing, could be head injuries, burns, scald from old or scars from old injuries, and then also internal injuries as well. So we can't rule anything out when it comes to abuse and potential injuries of these patients. Usually they want to hide them anyway because they're embarrassed about it. So that's not a good thing. All right, and then emotional symptoms, depression, suicide attempts, abuse of alcohol or drugs, and then feelings of anxiety, distress, and hopelessness. Abusers themselves may be paranoid, overly sensitive, obsessive, or threatening to you, to the patient, those kind of things. They often abuse alcohol or drugs and have access to weapons. So scene safety is the #1 priority if the potential abuser is still on scene. If you suspect abuse, your responsibility is to maintain safety for yourself, #1, and for the patient. To diffuse a tense situation, try to separate the patient from the abuser. As you question the patient, express your concern. Try to keep from judging the patient. If the patient refuses transport, some agencies provide information about domestic abuse shelters. In some cases, the presence of law enforcement personnel will be helpful. Learn the requirements for reporting cases of suspected abuse in your state. All right, so cycles of abuse, let's talk about those. The tension phase, which is the abuser becomes very angry and often blames the victim. The victim may try to placate the abuser or minimize or deny the abuse. Then the tension phase is usually the longest part of the abuse cycle. It is a horrible, horrible phase to go through. Then you have the explosive phase. This is when the abuser becomes enraged and loses control as well as the ability to think clearly. This is when most injuries to the victim occur, is during this particular stage. Then you have the makeup phase. This is when the abuser makes promises which are seldom kept. This phase helps to keep the abused person in the relationship with the abuser. First responders may enter a domestic scene anywhere in this cycle. It can happen. So understanding the cycles will help you to anticipate the actions of both the abuser and the victim. All right, violent patients. Immediately attempt to establish verbal and eye contact with the patient. This begins the process of establishing rapport. Check with the family members and friends about the patient's past history of violence. Signs of potential violence, any history of violence, yelling or verbal or threatening. In this figure, the patient's posture will indicate the potential for violent behavior. As you can see, this gentleman here, he's doing 2 things. He's pointing and he's got a hand that's close to the victim, who the victim is a female that is, cowering over in the corner, has no real escape area. Also, you can see by the look of his face, he's angry. You can see that this particular rescuer, not sure exactly what this person is, but his back is to an exit. Very, very important. You need to always leave yourself an exit. This guy just being in the corner alone is feeling threatened because he's got no exit. So he's more than likely going to be willing to fight at this point. So very, very dangerous type of situation. The best thing to do is if you can get the victim to come out from that corner and try to keep him, in a contained area, and then obviously having your back to the escape route. Now, law enforcement is the number one that needs to be here. This more than likely would be a law enforcement agent is what I'm thinking. This is a police officer based on I can see his radio right here. Very important stuff that law enforcement be handling this situation because they're going to take this guy down. They're going to try to talk him out and try to talk her out of there and diffuse the situation. Remember the hazards of a kitchen. There are all kinds of things in here that can become weapons. Knives, pots, pans, chemicals, just all kinds of things. So this is a very dangerous situation that you don't need to be in the middle of. So be sure that you're participating appropriately with law enforcement. All right, so continue on signs of potential violence: loud, obscene, or bizarre speech, pacing or inability to sit still, or protection of their personal space. And then, obviously, usually in these things, there's drugs and alcohol involved. That's a high percentage. Never force a potentially violent patient into a corner. Not a good plan because it's going to set them off and it's going to create a fight type of situation. And do not allow yourself to be cut off from a route of retreat, like we mentioned earlier. Have only one person talk with the patient. Okay, the communicator should be the rescuer to whom the patient seems to have the best initial rapport with. Anticipate the need to summon law enforcement personnel if all other means of approach and intervention fail. You need to have law enforcement involved with this, no matter what this says, as the need to summon law enforcement. You have domestic violence or any kind of violent patient, or you're on that call, more than likely you're going to be with law enforcement anyway. They're going to be the first ones to respond. They'll probably be there before you, but participate with them in the appropriate management of the potential abuser and also of the victim. All right, so violence against first responders. Several factors increase the risk of violence in the workplace, including working alone or in small numbers, working late at night or early in the morning hours, working in high crime areas, and working in the community settings. With the flavor of the environment of today's world, 2020, we tend to have quite a bit of, violence towards healthcare professionals and also law enforcement. So keep that in mind and keep your guard up. Situational awareness is number one. When you're on a scene or you're approaching a scene, look around. What is your situation? What is the scene before you get out of your vehicle? Is it safe? Do you feel that it's safe? Use your spidey sense, if you want to call it, to say, wait a minute, I need law enforcement along with me. It is better to call law enforcement than to attempt to tackle a scene on your own. So if it's not there, if they're not there, call for backup, call for help. All right, so be alert when you respond to a call that has an increased chance for violence, including the following situations: any crime scenes, any incidents involving gangs, large gatherings of hostile or potentially hostile people, protests, those kind of things, domestic disputes. Ways to minimize your risk. Although EMRs are more likely to be involved in potentially violent situations than the average citizens, there are ways to minimize the risk of injury. Take steps to keep yourself and other rescuers safe at the scenes. Always keep an escape route open between you and the patient. And obviously prevention. Prevention is the best way to avoid violence. As you arrive at the scene, use your personal antenna, your spidey sense, whatever you want to call it, situational awareness, to pick up any signs that you may be approaching a violent situation. Make sure you have an escape route in mind. Your ability to use good interpersonal and communication skills will help you to help prevent many situations from becoming violent. If you think you need backup or law enforcement personnel, request it early. Do not enter the scene until they get there. All right, the arm patient. All right, it is not your role to handle an armed patient unless you're a law enforcement officer. Be alert to potentially threatening situations and summon assistance if you think the person is armed. Stay in your vehicle. If you must, wait for a law enforcement officer. Don't get out of your vehicle. If it seems to be a threat, even with you in your vehicle, drive away from the scene, period. If, despite caution, you are confronted by the armed person, immediately attempt to withdraw, period. All right, some medical and legal considerations. You must understand the laws of your state and community relating to dealing with emotionally disturbed patients. You just need to know it. You need to know what the laws are, what the acts are for, a Baker Act, Myers Act, Marchman Act, those kind of things. If emotionally disturbed patients agrees to be treated, few legal issues should arise. If a patient who appears to be disturbed refuses to accept treatment, it may be necessary to provide patient care against the patient's will. So therefore, you must have a reasonable belief that the patient would harm self or others. As a first responder, you usually will not be responsible for transporting the patient, but you should know what the laws in the state permit you to do. All right, some other medical considerations. If you're required to restrain the patient, you need to think about the following factors: the patient's size and apparent strength, the patient's gender, the type of abnormal behavior, and the patient's mental state and the method of restraint you're going to use. Don't let size, fool you. They can be small and thin, male or female, and be a handful. So make sure you've got enough people. All right, so you may use reasonable force to defend yourself against an attack by an emotionally disturbed patient. To prevent problems, if you must restrain a patient, seek assistance from law enforcement officials or from your medical director. Document the conditions present in cases where you must restrain or subdue a patient. Whenever possible, a caregiver of the same sex should be the primary responsibility for the care of the patient. Let's chat about suicides. Many patients who fail their first attempt will try to commit suicide again. There are definitely different types of emotional crises, and this is one of them. You've got to have good communication skills with this. Each year, thousands of people, from teenagers to elderly persons, attempt suicide or self-inflicted death. Many patients who fail at their first attempt will try to commit suicide again. Most people who attempt suicide have serious psychiatric illnesses such as depression or alcohol or substance abuse. The patient may be under the influence of drug or alcohol at the time that they try to attempt suicide. The underlying psychiatric disease is usually treatable, and with proper treatment, the patient will no longer be suicidal. Management of an attempted suicide consists of the following steps. Number one is always protect yourself and the patient as much as you can from further harm. Obtain a complete history of the incident and then determine whether the patient still has a weapon or drugs on him or her. All right, so management continued, support the patient's airway, breathing, and circulation, dress any open wounds that they may have, treat for any spinal injuries if that's indicated, and do not judge the patient. Treat him or her for injuries or conditions you discover. Provide emotional support for also not only the patient, but also for the family as well. All right, PTSD, post-traumatic stress disorder. PTSD is a mental health or behavioral condition triggered by experiencing or witnessing a terrifying event. People experiencing PTSD get worse with time, and then their anxiety often interferes with their normal day-to-day activities. Some of the symptoms include the following: intrusive memories of the traumatic event itself, avoidance of places and activities or people that remind them of that traumatic event, specific negative feelings, and sometimes emotional reactions that nobody else is reacting to, but they're reacting to, and it's very obvious or socially unacceptable type of reactions, or even in small group dynamic unacceptable. As an EMR, your job is to protect that patient from harm, plain and simple. You need to speak with the patient in a positive and a supportive way and understand that PTSD is a true disorder. Arrange for the patient to be transported to an appropriate medical facility for evaluation and treatment. Right, so sexual assault, victims of sexual assault may be men or women, old or young. It doesn't discriminate. The psychological aspects and treatment are very, very important. You may have to delay all but the most essential treatment until the responder of the same sex as the patient arrives. So that's very, very helpful. So as a female needs to be working with a female, male to a male. Your first priority is the medical well-being of the patient. Treat any injuries that you see the person that may have. It is a crime, plain and simple. So do not remove clothing except to give medical care. Try to convince the victim not to bathe or to use the toilet. Use this, keep the scene and any evidence as undisturbed and intact as possible. And then avoid aggressively questioning the patient about the incident. Treat the patient with empathy. Maintain the patient's privacy by covering him or her with a sheet or blanket. Do not leave the patient alone. Death and dying, you're going to encounter this. There's just no way around it. The longer you spend in this field, you will come across this. You're going to encounter death and dying from natural, accidental, and also intentional causes. Do whatever you can to meet the patient's medical needs. Your attempts to save or give comfort to the patient help everyone to deal emotionally with the patient's death. Most people are afraid of dying. Work through your personal feelings about death so you can confront it in the field. Consideration is the key. Considering the psychological needs is very, very important for the patient and his or her family. Don't be afraid to touch. Make positive statements, but do not give false hope. Provide comfort in any way you can. In this figure, showing how this EMR is not afraid to show empathy to this particular patient. As you can see, there's good eye contact here. He is at the patient's level. The patient is on the stretcher. It's provided as much comfort as they possibly could. I mean, this could be anything. This kind of looks like an industrial setting type of accident kind of thing, but most of the patients that you'll be a part of death and dying are like hospice patients where they're needing to go to a treatment or to a physician's office or something along those lines, or you may be called when the family panics and calls 911. But this can happen at any time. I can tell you a story very briefly where one of our students went onto a scene of a shooting. And this individual student had to manage a patient's dying efforts because he was bleeding to death right in front of her, and there was nothing that could be done because he'd been shot so many times that he was dying right there. So he spoke his last words to her, and so therefore your role is to help with that comfort, because you're the last person this person is going to see on the planet. So you just work your way through that. All right, critical stress incident debriefing. First responders may need counseling to deal with the stresses of providing emergency care. If you let stress build up without releasing it in healthy ways, it can become to have negative effects on you and your performance as a first responder. Signs and symptoms of extreme stress include depression, inability to sleep, weight changes, increase in alcohol consumption or drug abuse. These are all things that are warning signs that things are beginning to bother you. So we need to be able to recognize them. Other signs and symptoms: inability to get along with family and coworkers, a lack of interest in food or sex. CISD, or critical incident stress debriefing, is there to help. It brings rescuers in, after the event with a trained person so that everybody can talk about each other's feelings and what's going on. Usually this happens following the incident fairly soon. It brings them together and it allows them to open up. It may help rescuers understand the signs and symptoms of stress and receive reassurance from the group leader. It also allows people to obtain more help from trained professionals if needed, so you can take it into a next step if need be. All right, so in summary on this chapter, only a small percentage of patients you treat will be severely or mentally disturbed, but almost every patient you care for will be experiencing some degree of mental and emotional crisis. No matter which type of incident or crisis is taking place, your response must be to help the patient. Behavioral emergencies, they're situations in which persons exhibit abnormal or unacceptable behavior that cannot be tolerated by the patients themselves, by the family or friends of the community. It's just unacceptable behavior, unacceptable social behavior. And it's not good for anybody. It's not good for the patient or anybody else. So it's good to work with these folks to try to get them some help. 5 major factors cause behavioral crisis: medical conditions, physical trauma conditions, psychiatric illnesses, and mind-altering situations, or mind-altering substances, and situational stress. 4 emotional phases to a crisis are high anxiety or emotional shock, denial, anger, and or remorse or grief. Although a person may not experience every phase during a crisis, he or she will certainly experience one or more of those phases. All right, so your role as an EMR consists of assessing the patient and providing physical and emotional care. Your most important assessment skill may be your ability to communicate with the patient. You need to understand the laws of your state and your community, especially those that relate for caring of emotionally disturbed patients. If an emotionally disturbed patient agrees to be treated, few legal issues should arise. However, if a patient who appears to be disturbed refuses to accept treatment, it may be necessary to provide patient care against the patient's will. To do so, you're going to have a reasonable belief that the patient would harm self or others. Usually, if patients are a threat to self or others, it is possible to treat and transport them without their consent. You need to have law enforcement involved with this. Even when you have thoroughly mastered the process and tools for managing behavioral crisis, it is important to remember that sometimes the best approach is to ask yourself one thing: how would I like to be treated if I were in this situation? So remember that, ladies and gentlemen, you need to look at that. You need to say, how would I feel if I was treating myself under these conditions? How would I want to be treated? Those kind of things before you move forward in your treatment. All right, you know what to do. Assessment time. You need to go ahead and go back to your Navigate dashboard, do the assessment block for this particular chapter, complete it, and then submit it. You may take the assessment as many times as you like. And remember, 70% or higher needs to be for each chapter, so retake it until you achieve that, or better. The more you take it, the more you'll learn. All right, with that, any questions, give us a holler. You can go ahead and send us an email. You can send it to your instructor at student@emets.net. All right, have a great day, and we'll talk to you again soon.